Hello and welcome to SLP Full Disclosure. I am your host, Jennifer Martin, and joining me today is a longtime friend and colleague of mine, Petora Spratt, and I'm so happy. I cannot wait to dive into this because as you'll learn, Petora has in many ways changed my complete professional journey. So before I introduce our guest, I want to tell you all about our sponsor, AMN Passport app. And on this app, you can find, book, and manage all of your travel assignments. It's kind of your one-stop shopping. So learn more at amnpassport.com. Once again, that is amnpassport.com. Petora is a licensed physical therapist and ABPTS, board certified clinical specialist in pediatric physical therapy. She is the owner of Precious Steps Pediatric Therapy in the Denver metro area and has been practicing for over 40 years. She has specialized in early intervention for the past 34 years, working on various transdisciplinary teams that specialize in premature and medically fragile infants that are discharged from the NICU. Her work history includes the NICU setting, pediatric acute care, outpatient pediatrics, infant and preschool programs, and home health. She is trained in the babies pre-steps model and is also a trainer in this model, and she has presented extensively on this subject. So welcome, Petora.
Thank you for having me. Appreciate it. And
Oh
yes,
my
we have known
gosh.
each other for a while.
Yeah, when I was thinking about this, I was thinking, when was the first time I met you? And it has to be what, 2006, 2007? I mean, it's been a while because
I, I I think you may have been pregnant with your first child, so I don't know how
yeah.
long ago that is. But it was, I remember it was in Commerce City. We were treating a family in an upper level
Yes.
apartment. I don't remember who it
Yes.
was, but
Uh,
yes, but I remember meeting you. And we ended up
yeah.
sort of co-treating by sort of default. Like you happened to show up
Yeah.
at the time I was there, or vice versa.
Yes.
And
Yeah.
that was sort of, it was like magic. So it's like, oh, let's do this more often. It just was there. Yeah,
Yes, I do remember that child's name. I'm not going to say it now,
yeah,
but I do remember
you
that
do.
child's
Okay.
name. Yeah.
I think it was
Yes,
a little bit
so
of a challenge.
we're going to have to get more specific when we say that because
Yeah,
we've also had quite a few of
yeah,
those as
that's
well.
true.
But okay, so before we get started, because this is a podcast that the audience is mainly comprised of speech pathologists, and I know you work with many of them, including myself. So just to get us started, tell us a little bit about your professional journey and what led you to where you are now.
Well, I started out way back when probably most people that are really listening to this were not even born yet, but working in a major teaching hospital back in New Jersey. I worked under a senior physical therapist. She was my mentor. In this major teaching hospital, we had senior therapists in each area, like orthopedics, pediatrics, med surge, and things like that. So I worked under the pediatric senior therapist, and she helped me with my emergence into the NICU because that was my interest and the follow up of these infants in the outpatient clinic. This major teaching hospital is a level one trauma center. Was very inclusive, cohesive department where we had PT, OT, speech, and doctors all together. Being a major teaching hospital, we did lots of rounding, medical rounds every day with the doctors and nurses and psychologists, dietitians, all of the different allied health professions. So early on, I had a very good exposure to all the extra disciplines, not just PT. So after this 2 years experience, I moved to working with, I worked in ortho and sports for a few years. It wasn't my gig. And I moved into pediatrics. I worked with a center. It was called the United Cerebral Palsy Center, but we worked with birth to 5-year-olds. I worked in the infant parent program. So we worked with infants and parents directly, and a preschool program. I worked in the medical setting at Children's Hospital in the Denver area, in an outpatient. And then I moved into home health, focusing only on early intervention. And that's been for the past only 25 years that I've just in early intervention, no home health. And then as time went on, I focused more intently on working with the medically fragile infant population and their families, and my increased training with the family-centered development and supportive care using the babies and pre-steps. That's sort of my journey.
Yeah, so it sounds like the pediatric population was meant to be, and that's where your heart was initially, and it still is. And I want to, part of the reason for wanting to do this episode is I think it's so important for disciplines, regardless of what the discipline is, to really understand why it's so important for disciplines to work together and how that ultimately creates better outcomes. But in order for that, I want to talk a little bit about our journey beyond the initial meeting in the upstairs apartment. And I felt like we had a really great connection. And from the beginning, you were somebody I think around the early intervention circuit, we would co-treat occasionally. And then we really connected and started this. And when I say this next part of the professional journey changed my entire professional road and what I was going to do, thanks to you. But it definitely is critical that we were working together with different disciplines. So let's talk a little bit about the NICU team and why you wanted to start it and why you felt like it was so important to have the different disciplines and the different disciplines working together so closely.
Well, the NICU team, I think, became a passion of both of ours or all of ours who were in this group. And I think one of the reasons was because of the large emphasis on transdisciplinary, which was true in early intervention, but even probably more so with this team. Just being able to work across disciplines, feeling comfortable to reach beyond my specific discipline, feeling confident to release a role release as a physical therapist while collaborating with other disciplines to best provide support for the infant and child and the family was so important. And this is what this team really helped us do. So an infant and child, we know, is not just a motor or eating or playing or communicating individual. They don't just do one thing, right? They have to do all these things in order to function. And having this transdisciplinary approach where we're learning about each other's disciplines and working with these children and families in this transdisciplinary approach, we know that all these domains must work together in order for each to develop to their maximum ability. So we knew that if a child wasn't regulated, and I think maybe we think of that as a social emotional. Well, that's a social emotional person. They'll take care of that. Or if they're not nourished, well, that's the eating. The OT or speech therapist will take care of that. Or if they're not interacting and communicating, well, the speech therapist or the ECSE will take care of that. But so instead of just thinking that I'm just going to work on head control and rolling and sitting because I'm a PT, but not to realize how all these different domains intertwine. And if one of these domains isn't doing what it should be, it's going to really affect the type of progress this child's going to make in my specific discipline or goal. So every area of development relies and depends on the other. You need to be aware of all areas of development. And when we're trained in school, we get sort of trained here. And when we're working transdisciplinary, we really need to be out in this area. We need to we need to have our periphery. We need to have that whole area.
Well, and would you do, because I feel like I remember even, getting out of school and, we hear a lot about multidisciplinary. And so it was a shift for me to start thinking of things as transdisciplinary. Can you explain the difference between what those two are, just for if somebody like me who's like, well, I know one really well, but the other ones I'm less familiar with?
Yeah, and multidisciplinary, again, you've got your PT, your OT, your speech therapist, your medical doctor, your nurse. You have all these different disciplines and mental health, and you're all an expert, I guess, per se, in your own discipline. So when that child needs motor, we get that PT. When the child needs speech or feeding, we get that speech therapist or OT. So you're working just in your discipline, but that this family has all these disciplines that are coming in, and whether it's in early intervention pediatrics or whether it's in adults, you have all these different disciplines. Whereas transdisciplinary, you may have one discipline in there who might be the primary one, the primary focus. This family or this patient's major concern is, I got to get moving. I got to get mobility. So that primary person going in there is physical therapy. But as a transdisciplinarian, again, we're realizing, well, gosh, we really need to work on nourishing this child. They need to be feeding. They need to be interacting in order to move across that floor, right? They don't. So that's where that transdisciplinary comes in. You can work on all these areas. Doesn't mean I'm an expert as a speech therapist, and I'm not an expert as an OT or a mental health person, but I have a very good understanding of those different disciplines to be able to work with the whole child. So that's sort of my difference between multidisciplinary. You've got all the different disciplines all working with this family. So think of a circle of the family, and these disciplines are all out there, the spokes of the wheel. They're all giving their inputs. Yeah, whereas transdisciplinary is your all-encompassing.
Yeah, that's a great way to think of it. And so when I think about it as well, I did these, arena assessments with little guys, kind of like what Child Find does. So, this child would come in and it'd be myself, an OT, a PT, maybe a ECSE, but each of us would be looking at just our area. So the PT is going to say, okay, here's the things we're going to do to see how you're moving. And we're all in the same room, but we're each looking at our own very specific discipline skills. So I'm going to do the receptive and expressive, and then this person's, and then we all say, okay, here's my information, here's yours, combine it together in a report. But it's valuable, but it's very siloed. Whereas when I started with you all in the NICU team, I think the biggest thing that it helped me realize was it really forced me to look at this, just like you said, as the whole baby. So instead of looking at, I just want to see what they're doing with, feeding and swallowing or communication, it became, well, yeah, when I see that they don't have any strength or coordination in other parts of their body, of course, that's going to impact their feeding. Or, wow, they're, cannot regulate. They're completely fussy and disorganized and distracted. So of course, they're not going to be able to focus on eating and to get the nourishment they need to grow. So it really was, when I say changed how I operate as a professional from then on out, it really did. And I think it just made me a better professional, where it's not, I think sometimes we feel so afraid to, well, I'm not a PT, so I'm not going to go there. And I'm not a this. And like you said, it's not at all me saying, oh, well, I'm going to pretend to be this or that, but it's having that understanding that every single thing impacts the other areas. And you can't, it's once you get it and see it, you can't separate it. I mean, don't you feel like you can't look at just your PT area anymore at this point?
Right. No, not at all. I mean,
yeah.
Obviously, I think you still have your discipline glasses on your strongest, right? Because that's what but you're, like you say, if a child's just laying back like this because they don't have any strength to come to midline, their muscle tone is so limp, and you're expecting them, they're in this position, you're expecting them to suck, swallow, and breathe, or if they're at the level that they're ready to eat purees or Munchables, and you're expecting them to swallow correctly when they're in this position, So does that have anything to do with PT? Well, yes, but does it also have anything to do with how you're going to approach feeding and swallowing, even with speech? You can't expect great speech sounds, coming from a child who's back here, or doesn't spend any time on their tummy and they're not getting those forward mouth sounds. So they're all related. As parents not interacting with them, how's that child going to do well in those areas? Yeah, exactly.
Yeah, and I think that is a key discipline that I think sometimes, I think it's easier to think, oh, well, the PT and the OT will work together, or the speech and the OT, but I think that mental health piece was also just changed how I practice because, like you just said, if you've got a parent that's suffering from depression or their own trauma, or working through their own things, how they interact with that child or baby is going to impact then how that child reacts and what they do. And so it really is it's so critical to even look at it from even co-treating with your mental health professionals, because I think that sometimes we think like, whoa, well, that's a completely separate area, when it really is so closely connected as well, just as PT, OT, speech are connected.
Exactly.
Yeah.
Exactly.
And I mean, here's an example too, maybe just for listeners, of how I feel like, if somebody's thinking about how they can incorporate this more into their team or what they're doing is, for example, if I'm going in and I see a baby that's just coming out of the NICU, and I'm looking at all the areas and observing and seeing how they're doing, and I'm like, I mean, this is an example that's happening right now. This baby, I said, I just feel like something is off with this. And, having Tora as the physical therapist that's part of this transdisciplinary team, I know enough to know I'm not a PT, but this is definitely impacting other areas. So I want to talk with her about it, possibly show a video. What do you think about this? And then she can give insight as to, oh, these are some things that you can do, or gosh, you know what? It really does probably require some more specific support from a physical therapist. But then it doesn't burden, or I shouldn't say burden, but just overwhelm these families that may be already dealing with a lot of appointments and medical and professionals. And if we don't need to bring in somebody else, then we don't want to. So that's just even an example of what's a case that we're working on right now.
Mm-hmm. Yes,
So,
teaming, like it's great to do co-treat, so it's
mhm.
wonderful, but it doesn't necessarily always have to be that co-treat within the home, like you're saying, not to overwhelm the family with all these different disciplines coming in. But if you're the one in there, but you're still seeing some things that you feel you've used your many tools in your hat that you have to approach the motor concerns you're having, but you want more input from the people who that's their obviously sort of expertise, if we want to call it. So that's where we have a transdisciplinary team that you can come bringing that video or bringing the case and saying, this is what I'm seeing. What is your thought on it? It would be the same for me with a feeding. I'm like, I've been working on some pacing with this child. I changed some nipple sizes. We've done this and that, but I'm getting this really the sounding clicking. The baby's not gaining weight or whatever.
Mhm.
I think it's beyond what I can do as a physical therapist. So that's like where we can bring the team approach in without overwhelming the family.
Yeah, it's just a different way of utilizing resources, which in many cases, some of these disciplines are already spread so thin. So it really, yeah, it's definitely been effective in that way. And I know it sounds like even when you were at the hospital, you were lucky enough to have a, a team approach, which I feel like I just didn't get a lot of that training when I was in any of my rotations or even going through school. But what was your philosophy on working with other disciplines before you really got started with this transdisciplinary model?
Well, I think I might be a little odd in that sense that I always embraced and respected all the other disciplines, and the nerdiness in me wanted to get all the information. What what was going on medically with this, and how medically that's impacting my ability as a physical therapist to progress to the goals we wanted. What was going on with the speech end of things, or the OT, or the nursing? So I was a little bit odd that I always embraced the team approach, maybe because I always liked other people too. Maybe that was part of it. Um,
It
but
helps.
yeah, yeah. But I just always wanted to gain as much knowledge as possible, and I was not a one that was afraid to ask questions. Sometimes you're like, "Oh, that's a dumb question." There's no such thing as a dumb question. Ask them and find out. Um, so yeah, that was sort of my philosophy. It might have been a little bit odd, but I always embraced the teaming.
Well, and for those that maybe don't have that background or hadn't really thought about it or feel a little bit like, I don't know. I mean, I wouldn't say threatened is the right word, but I think sometimes we think maybe it's a little bit uncomfortable to feel like somebody's in our territory or we're going in somebody else's territory. So, like, what do you think makes a co-treating relationship the most effective? Like how, what like getting started and then throughout, what have you in your experience has made that the most effective relationship?
I think first, feeling confident in your profession, that like I know what I'm doing. I'm okay with this, and being open to sharing and not feeling like that sharing, oh, that person's going to take over my job or something like that. It's not that. We're all working together to try to do the best for this patient, this client, this family, this whatever. So not to feel like I'm being stepped on. Um, Respect for the education and knowledge and knowing when it is beyond my practice. Again, being confident in my discipline and that role release, like where I'm okay with, Jennifer's fine with putting that baby in a high chair and doing some support in that high chair because she's worked with me long enough that I feel like, yeah, she knows that baby needs better support in order to feed better, or um, and also the ability to be a team player, a mutual understanding, like I said, of the ultimate goal. Our ultimate goal, we all want the best for these children, these patients, their families. So how is that going to be best achieved is by working together.
Yeah, I think those are great suggestions. And I think sometimes there's, and I know I've experienced this within my own profession, and I feel like some of the other therapeutic disciplines, sometimes we have this imposter syndrome where we feel like, well, I always want to have the answers, and I always want to feel like I'm giving the best information. And this really requires a step back and almost saying, you don't have to know everything. I mean, this is where
Yeah.
it's the beauty of the dance and the relationship is, hey, we're all putting our heads together to really, again, have the best outcomes for these children, patients, whomever it is students, whomever it is you're working with. I mean, at the end of the day, that's the end goal. However you get there, that's what you want. And do you have any advice if there has, how to communicate in a way if you feel like maybe somebody is like, let's say if I'm the speech path that I'm going down a little bit too deep into the PT road and it's maybe not an area that I don't have enough experience to really dive into that. Like, how would you recommend communicating that?
Yeah, so that's, I mean, and the team that we have has
Mhm.
been working so well together. I don't have those problems with our
Oh,
team. I just feel like everybody. But yeah, there are situations where I've come across other providers that maybe are like, you're really addressing that, but that's not maybe the best evidence-based practice across the disciplines. Like they might be saying to the family, "Oh, don't worry about he's not going to crawl. Just we're going to just work on standing." And this is maybe a speech therapist or an OT, and where I'm saying, it's really important that we don't go down to those lower um, level skills to develop core stability and shoulder girdle and pelvic girdle, and that's going to affect their fine motor down the road, and breathing and ability to make sounds and things like that. So if I find that there's maybe a discipline who's not making the best recommendations, and if I'm doing a co-treatment with them, I'm not going to call them out right during that time. Now, I may do it diplomatically, and I say, yeah, it seems like they're not going to be big crawlers, but I think it's a good idea that we work on this. And it's teaching, explaining why. What's the reason I want to do
Yeah.
this? And if it's not something that is seems appropriate to do within the moment, whether we leave that house together and on our way to the car, I just say, or I give them a text later on, an email. So being very diplomatic is important, not being accusatory, not attacking, again, respecting. So yeah, that sounds like a good thing, because this child doesn't really want to crawl, but you know why I really want to push that a little bit? That might not be their major motor locomotion, but I'm still going to work on some of those things that um, they might not like. So it's diplomacy. It's you know talking afterwards, uh, trying not to become defensive, um, and using a reflective way on your approach. And this is where I'll also bring in, I think it's important to have reflective supervision, because these are things you can bring to your reflective supervisor. Like, oh, I've got this OT I'm co-treating with, and they keep on pushing all this stuff, and I don't know. So this is something how you can work with your reflective supervisor. How is the best way to maybe we could approach that? And how are you feeling about that? And how does that make you feel? And so that might be a good thing too.
Yeah, those are great suggestions. And I love that it is just looking at it like, if a parent was doing something, we wouldn't say, well, no, that's not right. Don't do that. It is where many times we just don't know what we don't know. And so I think you're exactly right. Not, not doing it in front of whomever you're working with, but later saying, oh, what we've now learned and why this is important is this. So it doesn't put anybody in the defensive. And I'm also thinking too that I think one of the things that's made my co-treating relationships, also the ones that I'm thinking of that have been really great, it's that almost setting up from the beginning that communication. And I think even setting up some guidelines in the beginning, like, oh, I'm really excited that we're going to be working with this child together, patient, student, whomever. How do we want to best communicate? How do we want to plan? And I think even talking through that in the beginning could also help with some hiccups, because it really is that you're entering into a relationship with this other professional. And so it is where, just as any relationship, you want to set up, because we often come to things from how we want to receive information and what works for us, and think, oh, well, that must be universal, but we know that's not. So maybe even just having that initial meeting, like, I'm really excited we're going to do this. How do you want to operate? How do I want to operate? And I feel like that also helps to be just proactive with it.
Oh, definitely. And even at the day of a co-treat, you come in together. And so Jennifer, I really would like to have baby work on this rolling today, but what is it something that you really are working on? How can we bring that together? Well, I want the baby to really attend to mom more. Okay, well, we're going to get mom on the floor there, and we're going to work on the rolling, but they're going to be attending towards mom while they're doing this. So we could so it's something that we could even do in the moment of that day. Yeah. And it might be even, that's a good time too, that we could say, I know this baby's not doing much in crawling, but I really do feel that that's affecting their ability to pick up those little puffs that you want them to eat. So maybe we could work a little bit on that weight bearing first, and then we can move into seeing how they then can translate into picking up those puffs when we get them positioned in their height share. So I think, yeah, that's definitely a way. And I think there's going to be lots of times that, some of these providers out there are not necessarily in a situation where co-treating is either encouraged or expected, or and there's things that they can do to try to get their people to do this together, to get not to feel that they're isolated, because I think sometimes there's disciplines do get feeling very isolated, and I'm not getting this team approach. So talking to their supervisors or whatever and try to develop this team approach would be helpful.
Yeah, that's a great suggestion. So, I mean, I think whether you're working in homes, whether, and again, that could be with adults or peds, working in schools, if you have a, private practice clinic or even, a medical facility, these are all like I can't think of a setting where it wouldn't be really advantageous, to be honest. And I know that in every setting I've been in, whether it's, I did my stint as well with adults in the hospital, and I I worked so much with the PTs and OTs because it was inpatient rehab, and so you have to be a cohesive team. But even in the schools, I think it's something where we forget that we can absolutely do that. And in this home setting, I'm thinking about how much I've learned from you as a PT, just even thinking about positioning in the high chair for feeding. If it's like, oh, well, that was not ever I'm like, I work on the feeding, but helping with now with your guidance and that transdisciplinary approach, now I know what to look for when they're sitting in that high chair and what's going to help them to then be able to better accomplish those speech goals that I have set out. So I think it's a great idea. And it really does help when you're feeling, I know there's a lot of just, we're all feeling overworked and there's a lot of burnout within our professions right now. And I think that has been something that has helped me personally so much, is having that transdisciplinary where it does not, you don't get stagnant because you're constantly learning new things from these other disciplines that actually help you and how you practice. And so it just keeps it fresh.
Oh, definitely. And having, because we can't all be up on the latest thing on every evidence-based approach when it comes to every area of development, right? We're doing our best to just try to, read our journals and stuff, like praising things for our own specific. But it's, that way, I may say something that I learned years ago, and Jennifer's, oh, you know what? Yeah, they've just done some a big systematic review on that, and they've realized that that's not the best way to approach something. So, but I didn't know that because I'm not doing all the speech therapy or the occupational therapy journals. So yeah, but and then also, like you say, how I have learned so much over the years from people like you and other providers, that makes me a better physical therapist, and has prevented me from burning out. I know there's been people have said, you've been doing this for how long? And you're not done? Have I ever experienced burnout? Sure, I have in 40 years. I've been up here, I've been down here, up here, down. But I've always tried to find something to prevent me from dropping too low. And having a team to support me and encourage me and learn from has made the difference in preventing that burnout, total bottom out burnout.
Yeah, no, so much. And one of the things that I think I definitely want to point out to anyone listening, and we can put the information in the show notes, but one of the things that you are so very involved with right now are these learning collaboratives where you are working with groups. And a big part of that is not only, and this is specific to working with babies. So if anybody's out there that says, I've always wanted to learn more about this, and this is an area that we just don't get a ton of. We've all talked about it within our team that babies was just something where I felt like it was kind of like briefly touched on, and then it was just kind of like, because we thought, well, they're just babies, but now we know so much more. And I know you, along with some of the an OT, a mental health professional, also from the team, do these trainings that are and like year-long learning collaboratives. And what I think is so important and valuable about those, and having done it myself and gone through it with you, is that you really do learn and understand how to be transdisciplinary and how valuable that is, because it really doesn't let you just talk about one area without looking at all. It forces you to expand that. And again, once, like I was saying, once you learn it and see babies, kids, patients that way, you can't undo it. And it's just been so valuable. So if anybody's interested, I know, I would put that information in the show notes that they can contact you if you're okay with that. Because I feel like that understanding and the co-treating, working with other disciplines, it truly, I think, to your point, it allowed me the longevity in this career that has just made it to where even if I have those moments of, it's brief because it forces you to just keep learning and understanding. And then you see better outcomes, which then that also helps with decreased burnout.
Right. And just the support of each other, working, having the team time to reflect on cases. And because our work is hard, whether you're working in a rehab facility or a school or home health or early intervention or a hospital, it's hard work. And you need that support of your team to, reflect upon how are you feeling? What are you bringing into this case? Are some of your biases affecting this case? But I think that's very important. And just being there for one another, knowing that I always have this team to fall back on is important too.
Yeah.
Keeps me going.
It does. And so again, I think regardless of the setting, there's some way that this can be incorporated, whether it's, one day a week, I treat, even if you're in a school, I see a few of these students along with the OT or the PT. And, again, in the homes, in any private practice or medical setting, I think it's totally doable. And again, just if you're feeling that feeling of, I look and see if this is something that you can do, because it really does make a difference. And just to wrap up, I mean, what would you say are your biggest changes as, that you've seen working as a physical therapist with co-treating and working transdisciplinary with other professions? Like what would you say have been the biggest changes?
Biggest changes for me, confidence, not feeling like I don't know about when should they be saying baba? when should we be introducing purees?
Yeah.
Is this baby ready for this? I mean, probably before I didn't know all that stuff. I mean, so I feel much more confident in just general development of a child. I don't feel that a parent should, when I go in there, they should know, oh, you're the PT. Of course I am, but I want them to just think, I'm here to help support you and your child in their development. I'm just a developmental specialist. Granted, my specialty is PT, but yeah, I can address all areas, and I know when it's time for me to say, I've done as much as I could. I need to consult my team. I need to bring some video. I need to get a speech therapist in here. I need to get an OT in here. So confidence in just general development, and also the ability to know when it's beyond my ability.
Mm-hmm. And I think that's so critical that you say that, because I think many times people think it would be the opposite. Oh, well, if I have to rely and get information from others, then that means I don't know. And you're exactly right. We can't know it all. So it's this great where I'm going to age myself, but my encyclopedias, I've got the library. And so, yeah. And so thank you, Tora. I mean, you have single-handedly been one of the people that has just changed how I operate as a speech pathologist, given me the longevity to do this work. And I encourage anybody who's got more questions, or anybody who maybe wants to look into potentially having a learning collaborative in their area, reach out to Tora or myself, and we can get you directed. But we'll put all that information in the show notes. So
we'd love to do that,
Tora. Thank you for all of your service and everything that you've done. And again, I feel so lucky that I've been able to learn from you and be on the team with you.
Likewise, very much so.
And that wraps up this episode. Thank you for tuning into SLP Full Disclosure. For more information about this episode, check out the show notes on our website at medtravelers.com/SLP full disclosure. And don't forget to leave us a review and subscribe so you never miss a guest. Are you interested in becoming a travel SLP? Visit medtravelers.com to learn more and explore the exciting opportunities we offer at top-level facilities across the country. Also, a special thanks to Jonathan Carey for producing this episode and Aiden Dykes for the music and editing. And as always, this episode was powered by Med Travelers. See you next time.